I'm Natalie Porter. I'm here today to do a full body head to toe assessment on this 75-year-old male. The first thing I'm gonna do is, this is the room, pan around the room, and this is the instrument, like what I'm gonna be using today. My name is Natalie. I already said that anyway. So I'm introducing myself to the patient. My name is Natalie. I'm going to be a nurse practitioner today to do the head to toe assessment on you. I'm going to wash my hands, or I did wash my hands, and so now I'm going to begin the exam. The first thing I will do is, I did observe him walking in, so I did observe the gait. It's well coordinated and smooth. The first thing I'll do is look at the general appearance, assessing for eye contact, mood and affect, grooming, body habits, things of that nature. Everything looks, he's well dressed, well nourished. Yeah. Next thing I'll do is, alert and oriented. What is your name?
Lawrence Cook.
What's your date of birth?
10/29/48.
And what are you doing here today?
I'm here for a physical examination.
Okay, thank you. The next thing I'll do is, I'm going to, you have to bear with me, I'm nervous. The next thing I'll do is the head. I'm gonna inspect his hair and his head for anything, and I may or may not wear gloves with this, but I'll inspect the hair for any infestations, any masses, tenderness, lumps, bumps, anything like that. The next thing I'll do is, I'm gonna ask him about his TMJ. I'm gonna have you open and close your mouth. Okay, any pain, clicks, anything? All right, now I'm gonna put my hands right here to check for the masseter. Bite down, clench hard for strength. Any biting issues?
No.
Okay. Next thing I'll do is, I'm gonna look at his eyes. First thing I'll do is, I'll look at the lids. No lesions, close your eyes. No lesions, no lid lag. Then I'm gonna check the conjunctiva. That's pink, no discharge. Then I'll check the sclera. It's white. The pupil, sorry, not the pupil, the cornea is clear. Then I will make sure you're getting close. I'm checking stuff, okay? The next thing I'll do is, I'm gonna check for perla. So the first thing I'll do is, I'll assess the pupils. They're round, symmetric, and the shape isn't round. Okay. The next thing I'm gonna do is check for to see if they're reactive to light. So I'm gonna come around. Well, first thing I do is, you can either turn the light down, or sometimes you can put your hand here and you can come around and make sure you get it. I'm gonna come around. I'm gonna check 1, okay, and then 2, and they constrict, okay, and it's normal. The next thing I'm gonna check is concentric pupil reactivity. That's where I'll check, I'll check one side, but I'm gonna be watching the other one constrict. So here's that, and then you look at this one, all right, and then that one, and that one constricts. Okay, the next thing I'm gonna do is, I'll do the EOM, or extraocular movements. That is where you're gonna follow my pen light. I'm gonna do it in an H pattern. Put it on there. So I'm gonna go follow it. Don't move your head though at the time, just follow it. Okay, and bam. All right. The last thing I'll do with the eyes is, I'm going to check for accommodation and convergence. So I'm gonna have you look at my finger, and then look at the wall or the cabinets over there, and then I'm gonna bring my finger in Watch my finger now. And they should accommodate to my finger and converged in the middle. So his are symmetric round, reactive to light. So Perla's intact. Next thing. What would be the something else? Oh yes, oh yeah. I would do I don't have to do it, but it's a Snellen chart at 20 feet and his vision's 20/20. That's that. Okay, so the next thing I do is the external. I look at the ears. We'll go from the eyes to the ears. The ears, I'm gonna check the external ear for any lesions, and I'm checking both. For lesions, redness, anything like that. Then I'll check the internal or external auditory canal, which is just outside, for any lesions, discharge, redness. And that, okay. Then I will do I'm gonna move the pinna around, just moving them. Any pain, tenderness.
No.
Then I'll press in, any pain or tenderness. The tragus.
No.
Okay. And then the test, I'm gonna do a whisper test. What I'm gonna do is I'm gonna come up behind you. I'll be about 2 feet behind you. With the ear that I'm not testing, if you'll press it down press this part, the tragus down. So press right there, yeah. Press it down. I'm gonna whisper 2-syllable words. I'm gonna do 2. When you hear them, repeat the word. Baseball.
I can't hear it.
Okay. All right, we'll try again. All right.
Daydream.
You got that one. All right. Let's do the other one. All right. Baseball.
Daydream.
All right. So his hearing is not quite intact. He is hard of hearing. So the next thing I would do would be the nose. I'm gonna look at the external part of the nose and just look for any lesions, redness, swelling. Then I'll look at the internal nares for any discharge, redness, lesions. Okay. Then I will do you have to give me a second. Oh, okay. Sinuses. I'm gonna check the maxillary sinus and the frontal sinus, and I'm checking for pain or tenderness or any masses or anything like that. So this is the maxillary sinus. Any pain or tenderness?
No.
And this is the frontal sinus. Any pain or tenderness?
No.
Okay. I just have to think. I'm sorry. Pain or tenderness. Why are you putting it right up? Obviously. This guy's with nose. Okay, close your eyes. I'm gonna have you smell this substance, and I want you to tell me what you think it is.
Coffee.
Okay, so his smelling is intact. All right. The next thing is the lips. I'm gonna look at the external lips to look for any lesions. Then I'm gonna have you open your mouth. Look at the tongue. I'll use the tongue for for moisture, redness, or color. I'll look at the buccal for the same thing, moisture, color. And then I'll look at the palate for moisture, color, any lesions on any of the parts of the mouth there. Then I'm gonna have him, I also look at his teeth for any missing teeth. Open your mouth wide, sorry. Any missing teeth or decay. Now, I'm gonna look at the back and the pharynx and the tonsil. Say, look back here. And then I want you to say ah, so I'll check for the uvula to rise and fall. Say ah.
Ah.
You get that? Okay. All right. So the next thing is the neck. So the first thing I would do is inspect the neck for any lesions. Okay, and then, oh yes, I'm looking at the thyroid. Make sure it's midline. So that's just inspecting. The next thing I'll do are the, what do you call them, lymph nodes. So make sure you get close on this because they want to see where they. Okay, so I'm gonna check the pre-auricle lymph nodes, the post-auricle lymph nodes. Okay. Posterior cervical lymph nodes, anterior cervical lymph nodes, tonsillar lymph nodes, submandibular lymph nodes, submental lymph nodes, and subclavicular lymph nodes. Okay, now the next thing I'm gonna do is the thyroid assessment. So I'm gonna come from behind. Look, can you stand up for me? Or just turn, yeah. Thank you. I'm gonna put my hands here, just below the cricoid cartilage, and I'll press on one side and have the patient swallow. All right, swallow for me. Okay, other side, swallow. And that's just a test for any masses, enlargement, or tenderness of the thyroid. Then, I gotta do the carotid pulses. So that would be right, let me find it. Okay. Time out, give me. And you listen to them. You go on each side individually. How to find them? Why am I not? Should be right. All right. Then you listen to the carotid bruit. So you use it with the belly or stethoscope. And when I'm listening, I'll have the patient swallow when I'm swallow. Do it again. Okay. Swallow. Actually, I got swallow. All right, so there's that. The next thing I would do is inspect the arms, wait a minute, what would I go for next? Hold on, sorry. I just have to take a minute. Next for me. Inspect the skin of the arms, or the shoulders. So the shoulders, the arms, and hands on each side. Looking for lesions, bruising, cuts, anything like that. Then I'll go down, check for radial pulses. Oh, before that, hold on. First I'm gonna do this. I'm gonna check capillary refill on the finger. It's brisk, less than 3 seconds. I want you to put your hands like this. Do like this. That's checking for clubbing. So there's no clubbing. Okay. And then fingernails, I need to check them for round. They should be round, smooth, and pink. So texture, color, and shape. So I'm assessing the fingernails. Did the capillary refill. Skin turgor. don't even know if that's on there, but I know you do it. And then, next thing I'll do is the radial pulses. So I'm gonna do them simultaneously. Let me, hold on. Let me find them. There they go. Okay. And then I'll do the, oh, that's what the brachial pulses. I'm sorry. This is the radial pulses. My bad. Okay, so it's 2 plus bilateral for both. Okay, the next thing I'll do is, I'm gonna put your arms up like this, and what I'm gonna have you do is it's a resistance test. So I'm gonna put my hands here and I'm gonna push on you, and I want you to resist it. Okay, now I'm gonna pull on you. Okay, so it's 5 out of 5 strength. Then I'm gonna have you do the, we're gonna do a range of motion test. So basically, I want you to do, the first one, put your arms out like this, do flexion, extension, pronation, supination, okay, radial deviation, ulnar deviation, okay, and then I want you to do with your hands too. Say, okay, so flexion, extension. Oh, then that was the radial. We've already done that. Okay, so that's done. Oh, it's time for the reflexes. All right, so I'm gonna do the triceps, biceps, and brachioradialis reflexes. Okay, so the bicep one, now mind you, I've had some trouble with this finding it, but we'll try. I'm attempting it. So that's the bicep. Then this is the brachioradialis. Try to, how they did it on the videos. This is probably on the point. Okay, and then the tricep is over here, and just dangle your arm. I'm skipping. I attempted that. I have some trouble with that. Okay, so the next thing would be the lungs, or the chest. Oh, I forgot something. I'm sorry, take that back. I have to do the sensation testing. Okay, so I'm gonna have you close your eyes, and when you feel something, say now on your arm. This is gonna test the his smooth percept, like just feels the sensation of smooth objects on his hand. I'm gonna test on this forearm. Just tell me now when you feel it. And it's a cotton ball.
Down. 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 Down.
Okay, that's intact. Next thing I'm gonna do is a discrimination test of dull and sharp. So I'm gonna come on another forearm over here. When you feel a dull feeling, say dull. When you feel sharp, say sharp.
Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Okay, so he can discriminate between sharp and dull objects. All right, now it's time for the I know it's time for the you to, if you will take your shirt off for me. So the first thing I'm gonna do is I'll start with the back. You can come right here. I'll inspect the skin for lesions, any redness, any bruising. Everything looks intact, skin's intact. And I will assess the A to transverse diameter should be 1 to 2, and it is. Shh. Sorry about the dog. Then I'm gonna listen to his lungs. It has to be quiet in here. All right. I'll start up here, and we're just gonna go. All right, so it's about, okay, and take a breath each time I move. Okay, so take a breath. I'll just do it here. Make sure you can see. Okay. All right, so his lungs are clear. The next thing I'm gonna do is I'll come around to the front and inspect the skin on the front for any lesions or bruising. Skin's intact. So what I would, so you need to, so you would lie the patient down. I'm having trouble getting that to happen. So I would palpate the precordium, and so you just do this, and there's no heaves or any lifts. I don't know. I mean, okay, sit up for me. All right, now the next thing I'm gonna do is listen to the lungs in the front. Okay. Okay. All right. And then the next thing I do is I'll listen to the heart, and I'm going to do it with both the bell and diaphragm of the stethoscope. And I have to tell you, so I'll start with the aortic. Wait. Okay, that's right. Aortic. Wait, aortic. Pulmonic. Okay. Herb's point. Tricuspid. And mitral. Sorry. Okay. So we'll do it again. So the aortic. Pulmonic. All right, bend it over. Herb's point. tricuspid, like right around there. And mitral. All right, so that was, okay. Heart sounds. Now we're gonna do the stomach. Now I will be able to get into like, if you'll stand up and, now just come walk over here with me. Come over here. And lay down on this couch. Oh, that's the best thing I got. All right, I'm gonna listen to the 4. So I'm gonna inspect the stomach. It's round and non-protruding. And then I'll inspect that stomach. And okay, I did that. The next thing I'm gonna do is listen to the abdominal sounds. Okay. In the 4 quadrants, going here, 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 here. So we'll start. I'm gonna get down on my knees too. It's 8. Okay, then I would, the abdominal bruits, and that would be the aortic, the 2 iliac, and I would do the femoral too, but we're not going to do that in this video. I just have to state it. And check for that would be for checking for thrills. And then, I'm going to palpate the abdomen, the first one in the 4 quadrants. So I'm just going to go like this. Any tenderness?
No.
Okay. Any tenderness?
No. No.
Okay. And then this one.
No.
And then I'm going to do deep palpation. That's with 2 hands. I'm going to do it hard. Any tenderness?
No.
Okay. Okay. So, then I would check the inguinal lymph nodes, but I'm not going to do that. That's just what I would do. All right. If you'll stand back up, you need help. All right. We'll come back and sit over here. All right. So the inguinal lymph node, check those. And then now I'm going to do the legs. So, if you will let your legs dangle, I'm going to, okay, we got to do this fast because let me take your socks off so I can check for edema. All right, so I'm letting your legs dangle, no lesions, no anything like that. The first thing I'm going to do is I'll check for, the popliteal pulse. Oh wait, I'm gonna go ahead and do it. Popliteal pulses. So I'm gonna do this fast. Okay. And then I'm gonna look for the pretibial edema. I'm gonna palpate for that. There's no edema. Any ankle edema? Okay. The dorsalis pedis pulse. Okay. All right, and then and then the posterior tibial. Okay. All right. All right. Looking at toenails, they're round, pink, smooth, the texture, everything's good. I'm gonna get you to, I want you to push the resistance. I want you to push against my arms. And I'm gonna pull and you resist, okay? Now I want you to stand up and hold on to something like right here. Okay, I want you to do, so say flexion, Dad.
Flexion.
Extension,
Extension.
all right? Abduction, out. Adduction, okay? Inversion, eversion. All right, you can have a seat. So that's it with my physical exam. Now I'm gonna tell you about the quick, as fast as I can, because I know I'm running out of time. I do the breast exam for a female. I will inspect their breasts, looking for lesions, any puckering or retractions. Put her arm around her head on each side, palpate with the pads of my fingers, looking for any masses, any tenderness throughout the whole breast tissue. I would also check the areolas, and I would do assess for passive and active discharge. I would also palpate the tail of Spence. Then I would, that's the breast exam. Palpate the tail of Spence, then the breast, do that. Okay, then the male exam, I would do the female genital exam would be the, I'd inspect the, I would inspect the labia and vulva. I'd open the labia, inspect the vaginal and the urethral opening for any redness, tenderness, or discharge. Then I would palpate the Bartholin's gland for any masses or tenderness. And then for the prostate exam, I know I can do that real fast. I'd have the male bend over and with one, and I also would be using gloves and a chaperone during this whole time. So with lubricant, I would inject one finger and press down to check the prostate for any, and have the toes inward and press down and inject for any irregularities or any masses or tenderness of the prostate. All right, that's it. I know I missed the male genitalia, but I only have 2 minutes, and I can do it I can try. Let's see, you would inspect the skin for any lesions. I would palpate the testes for any enlargements or masses. Check the urethra for discharge. And then I would have taken the back end of my the reflex hammer, go down. This would be the charismatic reflex. I'll go down the inner thigh and watch the testes rise. That's as best as I got. Thank you.